Hello everyone and welcome to Annotated Medical Tutorials. Today we want to focus on the humeral bone. So this one is the longest and heaviest bone of the upper limb, and superiorly it articulates with the glenoid cavity of the scapula, and inferiorly it articulates with the head of the radial bone, and it also articulates with the ulna. It's generally divided into three parts, which is the upper end, the lower end, and the shaft. So let's start off by looking at the upper end. And the most prominent feature of the upper end is the head of the humerus. As you can see, it is 1/3 of a sphere and it faces backwards, upwards, and medial. So examiners usually like asking about this, about the direction of the head of the humerus. So it faces backwards, upwards, and medial. For those who can cram, this is the mnemonic. It's BUM for backwards, upwards, and medial. This head articulates with the glenoid cavity of the scapula to form the glenohumeral joint. However, the head of the humerus is larger than the glenoid cavity that it articulates with, and this makes the shoulder joint very vulnerable to dislocations. Moving on, immediately below the head of the humerus, we have got the line here called the anatomic neck. And the anatomic neck is important in that it is the line of the attachment of the capsule of the shoulder joint. Just below the anatomic neck, we have got two prominences or two tubercles. Laterally, we have got the greater tubercle, and anteriorly, we have got the lesser tubercle. In between, we have got the intertubercular groove or intertubercular sulcus. So whenever you hear the term sulcus in anatomy, it simply means a groove. And a groove simply means a narrow depression. Usually these are impressions for tendons or arteries depending on which groove you are talking about. So there's another groove that we're going to be talking about in a few minutes. Another name for this intertubercular sulcus is the bicipital groove. Here is another neck called the surgical neck, and it separates the upper end of the humerus from the shaft. An exam technique that I need to emphasize on. The examiners usually like comparing the surgical neck and the anatomic neck. And one of the things that you need to know is that the anatomic neck is wider than the surgical neck, and they usually trick you with that kind of a question. Now moving on to the shaft of the humerus, let's look at the lateral aspect of it. Here we've got a tubercle called the deltoid tubercle, and this one functions as the insertion of a muscle called the deltoideus muscle. And just posterior to it and inferiorly to it, there is a groove that runs here spirally, and it's called the radial groove. This one is the impression for the radial nerve. Now let's move on to look at the lower end of the humerus. So here we have got a ridge called the condyle, and then some prominences which are on the sides called the epicondyles. So on this part we have got the lateral epicondyle, and on this part we have got the medial epicondyle. The lateral epicondyle serves as the origin for extensor muscles of the elbow joint, and then the medial epicondyle serves as the origin for flexor muscles of the elbow joint. Just above the epicondyles, we've got some ridges here, and because they are superior to the epicondyles, we simply call them supraepicondylar ridges. So likewise, on the lateral aspect, we've got the lateral supraepicondylar ridge, and on the medial aspect, we've got the medial supraepicondylar ridge. Now let's look at the articular surface of the lower end of the humerus. Laterally, we have got the capitulum, which is the rounded projection, which will articulate with the head of the radius. And here we've got a pulley-shaped surface to articulate with the trochlear notch of the ulnar bone. So just above the articular surface of the lower end of the humerus, we've got some depressions on either side of the condyle, and on the lateral aspect, we call it the radial fossa. On the medial aspect, we call it the coronoid fossa. The radial fossa accommodates the head of the radius on flexion of the forearm on the elbow joint, and the coronoid fossa accommodates the coronoid process of the ulna on flexion of the forearm on the elbow joint. Let's look at the posterior aspect of the lower end of the humerus. The most prominent thing is the depression here called the olecranon fossa. This one accommodates the olecranon process of the ulna on the extension of the forearm at the elbow joint. This marks the end of the osteology of the humeral bone of the upper limb. If by any chance you find this video helpful, please subscribe to our channel if you haven't yet subscribed, and click the notifications button so that you can be notified when I upload the next video. If you want to test yourself on the osteology of the humeral bone of the upper limb, look at the link below or on the description of this video. We have provided a link to the video where you can go and do a quiz to test yourself. As of now, enjoy your learning. Goodbye.